Hello, everybody, and welcome back to All Things Medical Assistant. I am your host, Santino Ortez, for this podcast. And first and foremost, I want to thank everybody who's returned and stuck around to continue to listen to what I've had to say. And I want to thank all the subscribers who picked up the notification to click and join in. I do have a website dedicated to this podcast, allthingsmedicalassistant.com. There you will find all of my podcasts uploaded in real time as they're produced. And you will also find a little area there to leave a comment, question, concern, which I will address at the next podcast. As well, you can find these videos on YouTube at That Med Guy or All Things Medical Assistant. And if you're a new subscriber or a new listener, please, if you find this informative or entertaining, please continue to listen. If you're a new viewer, please go ahead and like the video, hit that subscribe button, get notified with the next upload, and hopefully we can all learn something here together. So I believe this is episode 17 here in season 1, and that's awesome. I'm getting some really good hits on this, so thank everybody for listening. I really appreciate it. It makes me feel like it's affirming, that what I've had to say is either rings true or makes sense or is agreeable. Again, if you don't agree, if you're offended, upset, or would like to make a comment, please leave a comment there at allthingsmedicalassistant.com. Leave a comment there. And if you're listening to me on Apple Podcast or Anchor.fm, you can leave me a voice message. And again, if you're listening to me on Apple, just please go to allthingsmedicalassistant.com and leave me that message, and I'll address it. So, this past week has been really, really, really interesting. It's been heavy in public, or rather national news, heavy in politics, and heavy at work. Again, I do work with an urgent care, and it's the best thing ever because I get to help people in times of need. We get some very significant calls that come in, and it's very satisfying to be able to help people on a level. But on that level, though, as a medical assistant, for all those medical assistants out there that are listening, or for anybody in the healthcare field that's listening, or even in the customer service sense, the provider or rep and customer patient relation is very important. Obviously, it's the ultimate sense of customer service. And one thing that I know that I try and do, and I've tried to do this in the 28 years I've been in this field, is give the most accurate information when I'm asked a question, be able to provide the most accurate treatment or the most relative and up-to-date treatments, and just to be that informed and be able to educate the appropriate way, which I believe all of us try and be. It goes to the core, to the heart of the ethics and the morals of being a medical assistant, or for being in the healthcare field, period. You're not there to cause harm. You're not there to cause any kind of confusion. You're there to help. You're there to comfort. You're there to help an individual in their need. This goes anywhere from a 2-month-old to a 93-year-old, which, we've had that, excuse me, we've had that dynamic there in my urgent care. Through this, trying to be the most, honest and ethically and morally appropriate healthcare provider, there's a lot of propaganda and outside information that comes in that makes our job worse, makes my job worse anyway, or harder rather, should I say, because people are berated with all this false information, negative information. They're scared. They're just told the bad stuff. They're never told the good stuff. Oh, COVID-19 is going to kill you, so don't get it. That's not necessarily true 100% of the time. You can get it and treat it appropriately, and feel sick and stay home and quarantine and get this virus through, and you'll be fine. You just got to follow the rules. You got to follow what your provider tells you. You have to try and adhere and apply to all of these rules that are and regulations that are being enacted by our municipal governments, state, even national, which anyways, social distancing, the masking, and last week I believe I covered, the whole masking issue where, individuals are just very reluctant. They're very, against it, and I don't think it has really anything to do with the masking. It's being told what to do. You're not telling me what to do. You can't tell me to wear a mask. No one's telling you what to do. We're asking you for your help to be part of the solution for this pandemic that's happening right now. Just the other day at work, we had a gentleman come in with their spouse and just did not agree to wearing a face covering, but decided to sit in our foyer. And unfortunately, we had to take specific measures, and law enforcement came out and spoke to him, and it just made the day that much harder for everybody. Not just for us as the healthcare providers to have that in the back of our mind, like, oh my gosh, this really can't happen to us at any time. But I can just imagine what it was like for all of the, patients that were waiting for treatment or care. They're probably thinking, oh man, is it like this? Or does it give them, does it make them, even more apprehensive about going to receive medical care because there's going to be defiant individuals all around? Well, unfortunately, it's a 50-50 shot. So, again, for all those out there that are, sticking to the rules and everything, thank you very much. And for all of you out there that aren't, I hope you find it in yourself eventually to understand and realize that this is a serious issue, and we need to protect one another, and if not for ourselves, for our families, for our kids, for our spouses, because if we can keep ourselves safe, our kids safe, our spouses safe, in turn, when they go into the community, they can keep everybody else safe. Because again, you've got these mass gatherings, whether on the beaches, the parties, grocery store, whatever. These measures are necessary. Okay, so please, I hope this makes some sense. So, thank you for doing the right thing. If you are, if you're not, I hope eventually the light comes on. But going back to being that we're berated with all this negative and false information, the biggest thing that excuse me, I think that happened this week was this, or last week, was this show of power behind this hydrochloroquine and the Zithromax. They even showed an African American doctor on the footsteps of a building saying, "We have a cure, no need to quarantine. We have." Well, this is not true. It came out this week by a very reputable medical institution and by the FDA, rather, I believe, that hydrochloroquine has been specifically, it has been labeled as not safe, period. So there's no more trials, there's no more tests. It's just been decided it is not safe, even though it's had a very, very, very small positive. It's had more negative. It's had more negative reactions to patients. It's made patients even more ill. So therefore, it's just not. It's not real. It's not true. And all of you out there that are drinking that Kool-Aid, that you're getting from your administration, or if you're of that population that believes that, oh yes, it's the answer, it's the cure, well then I really hope that you don't get sick, or anybody in your family gets sick and decide to take this medication and find out that it doesn't work, as opposed to doing the right thing, follow the municipal measures, the government measures, social distancing, masking, and washing your hands, instead of relying on false evidence, false proof. And these people, they were called doctors on the front line or something like that. Apparently, before that outrageous, ridiculous, and stupid show of conviction, that for sure it was a cure, that there's no reason to quarantine, no reason to fear. It's just, before that, I think that group had just formed like 10 or 12 days before that. So there's a lot of questions there, this re-election time, why all of a sudden was this group of doctors that is so sure, doctors on the front line or whatever, that they know for sure that this is a cure and that this is an end all to the COVID-19 virus. No, that is not true. And that whoever that physician is, I hope she's ridiculed, and I hope she is found to be a quack, and I hope, anybody who knows better, knows right, can just look at her and say, wow, you are part of the problem. You are part of the root of the problem. As doctors, you took that Hippocratic oath. You promised in front of God and your classmates, and your family or children to not harm anybody. And by going out there propagandizing things that are not true, because one, you are in awe of this TV personality, or because for some reason you feel like you're going to lose your job, or because you don't want to look like an idiot on that front. Well, you've just made yourself the biggest idiot. The biggest idiot. All those in healthcare that understand that this hydrochloroquine and Citromax is not the answer, all we can do is sit back and wonder, oh man, how much worse is it going to get? What's the next cure? Just like the intravenous use of Clorox and using vapes, Lysol. It's just ridiculous. It's ridiculous. That's not the way medicine works. Medicine is a science. It's not a witchcraft. But then again, in time, in this time, there's always been crazy people out there that have their own thoughts, and the conspiracy theorists. And hey man, I really believe Bigfoot's real. I think aliens are out there. I believe in La Llorona, La Cucuy, El Cucuy, but that doesn't mean that I believe that this medication is effective either. I know better. 28 years, I understand what the hydrochloroquine is good for, what Azithromycin is good for, and for this, it's not good for that. Those of us in the healthcare field, in the clinical sense, we try to keep up with the latest news to know what's good out there and what's valuable for the patient. And we get issues like this, oh man, it doesn't help anything, especially for all of those that are already non-believers in the healthcare system, and you feed them crap like this. It doesn't help, and it just makes access to medical care and access to patients to provide that care even harder. So those out there again that are eating that cheese to believe that hydrochloroquine, Zithromax is the answer, it's the cure. Please do a better study, do a better informative look, research, and understand what it's good for, and also learn why it's not good for COVID-19 and why it's not effective. Understand that, and then make a better decision. Okay, all right. I ask you to do that. And so, this week was very significant as well, as I've seen this change in people, even within my family. This change that COVID-19 is doing to people. Just the name itself. COVID-19. Neuro-COVID or neurovirus and C19. How it's changing people. I think the name just itself strikes the fear, because the whole time, like I said, since the beginning of this pandemic, we're given all the bad, all of the false, all of the inaccurate news. We're given death rates, we're getting infection rates, but we're not told about the good being done out there. We're not told about the lives that we have saved. We're not told about the people that have done all the hard work: medical assistants, nurses, doctors, laboratory technicians, front desk staff. We don't hear that. So, you've got people just watching the news, and the news is only reporting this negative stuff. Well, no wonder why people are freaking out. No wonder why people feel like there's no answer out there, because nobody will get on TV and talk about the good things. Nobody will get on there or the radio or whatever, internet, and say, hey, yeah, all this is happening. Yes, we're having a higher incidence of exposures, but that's through testing. But we are catching people that we do in the early phases. We treat them, or rather we educate them how to quarantine, how to be safe, and they get better. In the beginning, when this virus first hit, we didn't know nothing about it. I mean, the coronavirus has been around for a long time. If you get a can of Lysol and you turn it around and there's this beige label at the top, you're going to find back there that it's effective for the human coronavirus. So therefore, this virus has been around for a long time. It's just a matter of specific genetic type of this virus. Its genetic makeup, the way its DNA functions and what it does is once it affects the individual. That's where the difference is in the name coronavirus. The virus itself has been around, but it's its molecular and metabolic structure that causes issues within individuals. That's another thing to look up and I'm trying to understand is the genetic and metabolic processes that this virus goes through and what causes it to infect individuals and how it does. But just the name itself is striking all this fear. It's causing complications in human interaction. I mean, it's causing problems in the belief of the healthcare system. Somebody who I'm very close to was possibly exposed. And all she could think well, I'm gonna die, or why should I even do this? Why should I even try and test? What for? Because if I have it, I have it. That's that, and that was very frustrating. And it even felt very hopeless for me. And those of us that are out there in clinics testing, because medical assistants are testing, here in the state of Washington, anyways. Governor Inslee did lift the supervisory laws for the medical assistants, which here in Washington allows the medical assistants to swab nasopharyngeal or anterior nasal swabs for this. So the medical assistants are out there on the front line handling this virus. I'm in clinic handling it, transporting it. Grabbing the vial by hand, bagging it. I'm PPE, and thank to my God, I came out negative on a serology test, But yeah, so you've got individuals like me that are out there frontline doing this, living up to our ethics and morals, to provide the best care. And yeah, it scares the hell out of me because I have a family, I have a child, and I have to worry about bringing this home and infecting them or infecting coworkers or infecting people out in public. But I cannot let this name COVID-19 dictate my life. I cannot let this virus dictate my life. Now, what do I mean by that? Well, in the beginning when we had the involuntary, lockdown and everything, man, that upset me. Yeah, when they told me that I had to wear a mask every day, man, that upset me. And I didn't want to do it. I was saying no. But you know what? Since it's not about me and it's about protecting public health, I did it. Now, I know for a fact that masking helps because that's what helps during the flu season as well is, paying attention to droplet precaution, coughing, sneezing, coughing to your arm, sneezing to a napkin or, it's the same method. It's just, you're just basically wearing your sleeve or your napkin on your nose, really is what it is. So, it's not so much for me to be protected from you in that sense, but it's for me protecting you. So, when I sneeze or speak, I don't, let out that droplet precaution in essence, affecting you. And we need to stick together. We need to make it through this hard time together. We need to understand that this potentially could get worse and that currently there's nothing out there enforcing the fact that there's good being done out there, that there have been many lives that have been saved. We have to go out there knowing that purposely I'm going to go to work and put myself in danger and put myself in the face of exposure. My coworkers put themselves in the face of exposure, and they go home to their families. They go home to friends. They go to the grocery store. They go to public places, and they adhere to the social distancing and masking rules. But still, it's still an exposure risk. And I do that 4 days a week, maybe 5 or 6 if I pick up overtime. Now, can you imagine how many healthcare providers out there are doing the same thing? But they do it because this is what they signed up for. They do it because they're either enough for this kind of thing or because it's their duty. When they went to school, they made a promise to take care of people no matter how hard it got. No matter how, deadly it can be or how infectious or how negatively it can impact us. We still go out there and we do it. And again, this ranges medical assistants, certified nursing assistants who are out there being given, the poo of the worst jobs. And how about those that are part of environmental services, janitorial staff? Not just in hospitals, but clinics and schools. Nobody thinks about them because, I guess since they're such a lower, class of such a lower part of the structure. They're just not thought upon. They're just thought, well, that's where they chose to be. No, they didn't choose to be that. They chose to help people. So they took the best way that they could to start their future, or because they want to take care of people. So all of you out there that are that thought of mind that, oh, well, a CNA or a janitor, if it weren't for those people, would you do it? Nah, I don't think so. Because if you're narcissistic enough to think like that, then what's the point in trying to even talk to you? Again, people like you that are narcissists, people like you that just think that, this administration is the best that we've had because it's the whole truth, and I just hope you don't get this, and it's unfortunate because those of you that think that this is a bunch of bull, or that it's a created, or it's a hoax, because of you, you're half that population that are going out there and spreading this damn thing when it happens. The other half are just the knuckleheads that just choose not to abide by the rules because they don't want to be told what to do. Because they have a right to choice. No. But I'm going to tell you something. Just because you think you have the right to your, as I said last week, your freedom and liberty, you have the right to sit down, think about things the appropriate way, and do the right thing. Actually, you don't have the right. You have the responsibility to do that. Sit down and think about the right thing. I laugh at the news segments that say, okay, a whole beach of kids went out to party and now half to 2/3 of them are sick, or a family had a house party and they're all sick. Well, you know what? You kind of asked for it, and you don't believe it's real until things like that happen. Whatever. I just hope, again, I wouldn't wish this on my worst enemy, but again, if you have any sense of direction in your life, any sense of morality, please pull that forward and put that narcissism behind you, and take that time that you use arguing, and that time that you use, contradicting. Why don't you use that time to educate yourself, to learn about this, to learn how it's affecting people, and to learn how it can affect you if it hasn't. Because I know I'm sure there's a good amount of people out there that thought that this was a hoax, and now they've been infected and they had to quarantine. And I'm sure there are people out there, unfortunately, that thought that this was a hoax or a joke, and now they're gone. They've died. They've passed away. And now the families are upset. And now it's another conspiracy. The Democrats did it. The Democrats sent it in an envelope and infected them. Just like that congressman that went to session without a mask, and he ended up positive with the coronavirus. It is a stupid excuse. Oh, well, I was just handling my mask a lot, so that's probably how I got it. I can't believe somebody that ignorant would even be in a position to make law. I can only imagine the people that voted for him. Forget it. And this type of behavior flows into another issue, is deception and lying. People are lying to get in the clinic to test, and it's not, and it's no big news. It's nothing new to know that, there's not this overabundance of testing out there. We're there to test the symptomatic people. We're there to test those that are possibly exposed to symptomatic. I don't know what's in the works right now as far as maybe a mail-in option or something like that, or some kind of a saliva test. Who knows? But what I'm saying is, there are people that are coming to clinics, urgent cares, and their doctors, and they're saying just the right words to get in, and then they get in and they lie, and they say, well, I did register with this chief complaint, but now that I'm back here, I'm actually having these symptoms, which are COVID related. And then they test, and then they come out negative, and it's just for their, that's wrong. Because what you're doing is, when you're going in and you're deceptively registering in a clinic and saying that it's for one thing, and then you get into the back of the clinic and say it's for another, you have potentially exposed all of the individuals you've come across with, because you wanted to lie and you wanted to deceive. Now, I understand this is a scary situation, and I would love for everybody out there to get tested. I would love for there to be like a mass mail out of PCR, polymerase chain reaction tests. I would love that. That would be great. That would be ideal, because then we can just test everybody at once and catch everybody who's asymptomatic and who's probably symptomatic mildly, or those that are starting infection. And even then, if you test too early, you could still have it. We just don't pick up enough of a viral sample. But in effect, while you're going around lying about symptoms and trying to get in and this and that, because otherwise you would probably be told, no, since you're not symptomatic, hopefully you don't. But if you do become symptomatic, then please call us back. That's not right. Again, you're part of the problem by being deceptive and lying and potentially exposing all of these people. You see, and here's the thing, your conscience will never weigh on you because you will never know. For all you know, all you've done is you've gone to a clinic, you've lied to get in, to get tested, you've gone out, and you've walked out. And because you're not going to see all of these people you've came across ever again, it doesn't weigh on you. You don't think about, oh, did I expose? No, because it's a one for all, one for all mentality, you above the rest. That's wrong. Not in this situation. So all of you out there that are thinking about lying just to get tested, please don't do that. Because in effect, if you are without infection and you go somewhere and you're on somebody who's potentially infected, you potentially expose yourself. So you know what? It just might happen either way. But don't lie, because you could put yourself in that situation as well. Obviously this is an unprecedented time. We've learned so much about it since the beginning. So much work is being done. So much work has been done. And this is the way of life that we should be following. We should be leading by example. We should be there to help each other, to be, as I say, a steward of our community, a steward to our family. And that's what makes the difference. Everybody who I see masking, sanitizing their hands, I applaud you, because you are part of the solution. You are part of the solution. And for all of you out there that still think this is a joke, well, I wish the best for you. But with all that come together, how's that affected me being a medical assistant? Oh, heck, I have to fight hard. Well, not fight hard. Well, okay, I have to fight harder to convince an individual. I have to fight harder to keep myself from being exposed. I have to fight harder to keep my sanity, to keep my individuality in check, because I'm out there every day, 4 days a week, like I said, purposely exposing myself. I'm trying to keep myself mentally in check, and try and keep myself mentally strong for my family. Yeah, I can't go around, placing myself potential exposure and then, not worry about the family. Now that's stupid. Like I said before, I'm tired. My body is tired. And it's sad. It's sad to hear of all the new cases and all the new deaths and how it could have been prevented. Now, I'm not sure if there are of you that are listening that still don't think that this is a real deal or it's still a hoax. Again, I hope it doesn't happen to you. But because of people like you, this makes this situation so much worse. And on that, I would love if anybody out there is listening, if they are of the conspiracy theory era, or if you think that this, send me a message, anchor.fm, send me a voice message. If you're listening to me at apple.com, go to All Things Medical Assistant, send me a message. If you're watching this upload on YouTube, please go ahead and leave a comment, and whatever it is that I get, I will address at the next podcast. But anyways, this is Santino Ortez for All Things Medical Assistant. Thank you for listening. Again, if you're a new listener or a viewer, please subscribe, like the video, hit that bell so you're notified for the next episode. And then as well, I try and upload once a week, Friday, try no later than Saturday. So sometimes I'll be a couple of days late if I'm still trying to decide on a topic to speak about. But either way, please be safe, be a steward to yourself, to your family, to your community. And thank you for listening. We'll talk to you soon. Bye-bye.